Thank you, Mr. Chairman, and thank you and Senator Tester for having this very, very important hearing, leveraging the community to try and do a better job with suicides. Secretary Wilkie, first I want to thank you for being so proactive in this area. We've had a lot of conversations for a long period of time, and I know that this concerns you as much or more than anyone. And we do appreciate your leadership, and then also Dr. Franklin for the job that you're doing. Let me congratulate you too on community care. We're probably not out of the woods yet. There's going to be some things that crop up, but again, I know that you and your team have worked very, very hard to do the best you could on the rollout, and so far so good. So that's very, very good. As I mentioned, we've spent a lot of time talking about suicide. The problem is that we have the statistics. They don't seem to be changing very much. And as you just pointed out, in 2010, the VA requested $62 million for suicide prevention outreach. In 2020, that number nearly quadrupled to $222 million. In mental health funds, more generally, we've gone from about $4.5 billion to almost $9.5 billion. So we've spent a lot of money. And then again, despite this, the significant increase in funding, we haven't done a good job of reducing our numbers. Now, as you point out, one of the major problems is most of these people are not within the VA system, and so it's very difficult for you to be able to have a positive impact on that if you're not taking care of them. And yet, that's why this hearing is so important. What do we do? How do we use the community? How do we use all of the things that are out there to try and get people in the VA system? And I would even argue, right now there are tremendous resources there, but they're not coordinated. And it might even be such, if you Google, help, if you're somebody in need, you'll get probably, I think it's 40,000. That can almost be another stressor if you're in that problem. And so again, this is really what it's all about, is trying to make it such that we can work together to reduce the risk. So I guess the question is, talk to us a little bit about kind of what's going on now. You mentioned that myself and Senator Warner had drafted a bill. We've worked very closely with you all to try and do things a little bit differently, where we can use the community to try and capture folks, and then also put the metrics in place. What we want to do is recognize programs that are working well, plus those up through grants and funding, as opposed to just throwing money at the problem.
Yes. So I'm going to tell you what the 5 lines of effort that I have laid out for the Suicide Prevention Task Force, and tell you how the ideas that you have put into legislation have actually worked in Little Rock for homelessness, and I use that as a guide for the national effort. So we'll have 5 lines of effort. One is what you said: state and local grants, getting out to the people who are closest to those that we don't see in the Department of Veterans Affairs. A national research strategy that brings in NIH and the National Academy of Medicine. Workforce and professional development for our own people to make them more cognizant of the signs that exist in our veterans who may be in danger, and then better communication, and then cementing those partnerships that start with grants. So in Little Rock has eliminated veterans homelessness. That's important because Arkansas has one of the highest per capita levels of veterans in its state's population. What Little Rock went out and did in coordination with the state was bring in the churches, bring in the charities, create a city and county-wide roadmap for them to go into areas where the federal government wasn't, bring people off of the streets, get them in transitional homes, and then give them to us to help with vocational rehabilitation and education. I see that happening now with suicide. Senator Sullivan's walking in. In his state, 50% of the veterans are not in contact with VA. Alaska's a state where people can go and get lost on purpose. The Alaska Federation of Natives and I have had deep discussions about how to get into those remote areas and help us find those veterans. State and local grants of the kind that you've laid out in your legislation will make it easier for me to help his people and then the charities in a state like Arkansas to get out and find those folks. That, what you have is the key, I think, to unlock part of this crisis.
Good. Well, thank you, and we appreciate your support, and again, all your hard work. Mr. Chairman, thank you.
Senator